Nclex is the toughest exams you will ever take if you're a nurse.
Oh.
It's nothing compared to the CBT or the Ghana NMC exams. I think the IELTS is also challenging for people.
Yeah.
But I mean, I know people who took the Nclex because they couldn't get the pass mark for the IELTS in the UK. So the IELTS in itself is a terrible. is also difficult in itself. But I'm talking about nursing exams. Yeah, I'm talking about nursing exams. If there is a nursing exams you have to take, so far the three are taking. The Nclex is the most challenging one, and it's because the Nclex
is. Welcome back to my channel, all my returning subscribers. I'm so glad that you made time to find yourself on my channel once again. This is your girl Nurse Sabina, a psychiatric nurse in the Republic of Ireland, but a proud Ghanaian. I was trained in Ghana, so you should know, obviously I am proud. So guys, today we are going straight to the United States of America. The last time Priscilla was here to take us through the process of how you can get to the US as a registered nurse, and so today I'm here with another US registered nurse. But there are so many things that we are going to learn from this man. So guys, just stay tuned with me, and then we have a lot. Any questions that you want to even ask, you can just drop it in the comment section and we will definitely make time and respond to you. So guys, if you're a registered nurse and registered midwife and you're contemplating of relocating to the United States of America, you know the major test you need to take is the Nclex. So now many other people that are asking so many questions about how to pull through successfully with the Nclex, because you know it is not just about IELTS. It's not like you coming to Ireland where you need only IELTS or UK. No. So obviously when you're going to US, you need Nclex. Nclex is the major test that you need to take. But how do you handle that? How do you go through that? So Manasseh Teta is a US registered nurse who has successfully gone through the Nclex, and he's here to help us understand this entire process. But don't forget, this same man was a registered nurse in the UK. So the major question we have for him is, why did he leave UK to US? So guys, if you are happy for us to have this conversation, thank you so much for joining us. Let's just go straight to our guest and let's begin our session. So Manasseh, thank you so much for joining us. I'm so glad that you made time for us to have this session.
My master's program on hold at the University College of London, so I deferred the course and started preparing to take the Nclex exam because we had to move to the US as a family as a family decision. And then we moved to the US, and you know there are good schools in the US as well. There are a lot of top 5 global public health universities here. So if I wanted to I could do both and also work in the US with my wife, and she also pursues her dreams because it was her options were more towards getting to school here as well.
Okay. That was a good one. Yeah, that was good. Your journey from Ghana to UK is actually inspiring. But guys, this is just a tip of an iceberg from Manasseh. He has a lot of information about UK nursing and US nursing. He is also a YouTuber, so you can equally slide into his channel and you see lots of videos about UK nursing and US nursing. So I know that generally you need to sit for Nclex, and you even made mention of it that you had to defer from your master's course so you could focus on the Nclex. So with somebody who wants to also embark on the Nclex journey to finally become a US registered nurse, how is it like? Where do you even start from if you want to take the Nclex?
So let me just say that the Nclex is the toughest exams you will ever take if you're a nurse. It's nothing compared to the CBT or the Ghana NMC exams. I think the IELTS is also challenging for people. Yeah. But I mean, I know people who took the Nclex because they couldn't get the pass mark for the IELTS in the UK. So the IELTS in itself is a terrible. is also difficult in itself. But I'm talking about nursing exams. Yeah, I'm talking about nursing exams. If there is a nursing exams you have to take, so far the 3 are taking. The Nclex is the most challenging one, and it's because the Nclex is not necessarily a content test. It's a thinking test. It's testing the way you think, so that you think in the American structure. Like the way they prioritize things, the way they see patients, the things that the order in which they see patients and stuff like that, risk analysis and so on and so forth. So that's what makes the Nclex a difficult exam. But the Nclex is like it's becoming more and more open now. People are beginning to get to terms with it, and the pass rate has really increased. And it's not about, it's difficult for people who are not trained in the US, and it's not because the US nurses or the US trained nurses are more intelligent than African or UK nurses, or it's just that the modules of training is different from what we are used to. And so I tell people that if you want to take the Nclex, it's about having to unlearn what you are used to and relearn the new thing. So it's not just about learning; it's having to unlearn and then relearn. And that's what makes the Nclex a bit tedious. But now they've even brought about a new type of Nclex, which is called the next generation Nclex. Now, the next generation Nclex is more of a scenario-based assessment. So they give you a scenario. Let's say Abina comes to the unit. She has difficulty breathing. There's wheezing respiration. When you press her feet, she has bilateral pitting edema. And when you do the assessment of the chair, she has crackles or wheels and all of that. What do you think? Then they'll ask you 5 questions based on the scenario. What do you think she has? What are the signs and symptoms that are congruent with what she's experiencing that you would have seen in another patient? And what are the initial treatments? What bed position will you place such a patient in? And so on and so forth. So
the nature of recent Nclex questions, right?
Yeah, that's the nature of the next generation. And they've so now it's not just like a Q bank where you go and buy your old Q bank and then you have to memorize the questions. And now they give you a scenario, and then you make and I think that's good for both of us Africans, because that's how education in Ghana was more like. They give you the scenario, especially when we are doing midwifery and all of that, medical nursing in Ghana. They give you the scenario and then they ask you questions that follow, because once you understand the pathophysiology, you are able to answer the questions.
Answer the subsequent questions. But let's see, just as IELTS is in IELTS has differences like the IELTS academic, UKVI, and the rest. Is it the same with Nclex? Does Nclex also has different types that nurses are specifically to take? Those ones.
The Nclex is just one. It's just one Nclex. It's a standardized exam, and it's like you have to learn the same materials. And it's one level playing field for everybody, except you are not an RN. But if you're an RN, it's the same, because they have Nclex LPN as well. They have Nclex for nurse practitioners or DMPs for their board certifications, and then they have Nclex for registered nurses. So Nclex RN is the same for every RN, regardless of So it's not like the IELTS where you have.
So what if the candidate is a midwife or a psychiatric nurse? You still take the Nclex RN. Is that it?
Yes, I think for the registered nurse, definitely for midwives, I understand you need to get a bachelor's degree to be able to get your midwifery registration done here. And in the US, there is no difference in training for psych nurses, or like an RN like me can go and work in psych. An RN like me can go and work in labor and delivery. So once you get an RN, that's it. But if you are an internationally educated midwife who needs to come to the US and practice as a midwife, I'm told you need to get a bachelor's degree, a BSN degree, before you can be allowed to practice as a midwife here if you're from another country.
Does that also applies to psychiatric nurses? Do they also have to get their bachelor of science before they can also be registered as psychiatric nurses?
Yes. Because the belief is that you need to, for an RN here, you can go. I'm not a psychiatric nurse, as in the sense of a psychiatric trained nurse in Ghana or Nigeria, but I'm just an RN. But I can go and pick a job in a psychiatric hospital and I'll work normally, very fine there, because it's an RN license that covers everything.
Of course, that's very interesting. So guys, if I'm a midwife, a psychiatric nurse, a general nurse, and you are thinking of relocating to the United States and be a US registered nurse, of course you need to get an Nclex, and that is what Manasseh is taking us through. But Manasseh, you practicing in UK, how long did you practice in UK before leaving?
It was just about 2 years.
2 years, perfect. Definitely you learned a lot of things in the UK nursing. So what were some of the benefits that you think you were so happy about being a nurse in the UK?
Oh God, this is like an emotional one. Like, the UK is one of the best places I've worked. I really enjoyed working in the UK. I tell you, like, my team on the stroke unit where I worked, were just fantastic. I mean, they're an amazing bunch of people, and I learned a lot. You know, I worked in stroke medicine in the UK, and I learned a lot of things. I mean, the manager was good enough to let me go to a stroke master class, and I was going to all those programs, and I learned a lot about stroke care. And you know, the NHS is one of the most complex national health systems in the world. It's not even the US. The US is more like a privatized system where every hospital has their system. And so you can have a group of hospitals, that kind of thing. But the UK is more like a national scale thing. So it is big, and it is serialized, or it is standardized across the board, so that it is the same for everybody. And that makes it difficult to run. So you need to understand the thinking of the people behind the NHS and give them credit for how they've been able to make the NHS run. So working in the UK, one of the things you learn about is the new structures, how they are what do I call it? Their policies protect the patients, such that the system. Someone said that the system in the UK, the NHS is what saves the patient and not the doctors, because the system tells the doctor what to do. That if the patient comes with this, do that. If the patient comes with this, do that. So there's a lot of non-subjective rules in the NHS.
Now let's look at lifestyle as a nurse in the US. How is it like?
Lifestyle. I mean, generally, nurses in the US are okay. They live a good life. And one of the things they talk about a lot here is burnout, because it's difficult, it's stressful. And it's another part of nursing in the UK. In the UK, they always used to tell me, take off your mental health. Your mental health is important, and all of that. And people use that to mean that you need to find a girlfriend or a boyfriend. But I mean, about your mental health, whatever makes you distress and ease your stress is the mental health. So it's good. It's good. Like, it's the same in the US here. It's stressful, the work is hard, and it can affect you both mentally and physically. So you need to, like, put yourself in a situation where you are able to take some of the stress from yourself. And so socially, it's good for nurses in the US. It's not, but
it's good generally.
It's good.
I think, Manas, I wish we have more time, so we could have a longer discussion. But I just have to. I just can't take much of your morning today. So thank you so much for making time for us to have this conversation. But in conclusion, is there anything you being and now you have had experience when it comes to international nursing? What would you say to fellow nurses who are still in the process, wanting to move to UK, to US? What would you say to them?
I think that
based on your experience.
People have to realize that, you know, this whole thing about nursing, you need to be really interested in it to excel at it. And if you have a dream, it's not too difficult to go after your dream. I mean, it's challenging, but it's not a novelty. It's been done before. People are doing it, and people will continue to do it. I mean, the playbook as to how we are doing it, or how we migrated within these countries, it's out there. The playbook, it's not a secret. It's out there, so you can do it. People have done it, and so you can do it. And so, if you have a dream, just continue to pursue it. I mean, the demand for nursing will always continue to be on the rise. One of the things the chief nursing officer here told me was that she graduated from nursing school in the 80s, and there was nursing shortage. And in 2024, 40 years down the line, there is still nursing shortage. So nursing shortage is not a one-time disease like COVID, which comes and goes. It is like hypertension, which has been there from time immemorial and will continue to be there. So it's perennial. You can take your Nclex anytime you want. And once you have the interest of working as a nurse in the US, just commit yourself to the process. Go through the right process and become a legal immigrant. And you're going to be happy you did. But if you're working in the UK as well, what you want to, some people just have the chance of working in the move of being in the UK. I mean, like myself, from the time I was young, I've always wanted to work in the UK. Where I wanted to be was in the UK, because I had this pen pal who was an avid Manchester United fan, and when I was young, she used to send me poster cards of Ryan Giggs and all those footballers. So I really wanted to live in the UK. So if it's the UK that you want to live and you're living, just be happy you are living there. And if you want to make a move, you are always free to move, whether to Australia, to the US. I mean, I have US nurses ask me about moving to Australia. So nurse migration is not only for Africans or Indians or Filipinos. US nurses also want to move to where they feel is better. So it's a human thing. It's in it. Like as a human being, you have a desire to move to where you feel like it's a better place for you. So let's continue to pursue our dreams. And once you get a job, just give off your best there. And
continue to pursue your dreams. I think this is something you should not forget from Manasseh. Continue to pursue your dreams. Whether it's Australia, you want to go, UK, Ireland, US, Canada, wherever you want to go, you just have to pursue your dreams. Manasseh, thank you so much. Thank you so much. Thank you. Can people actually link up with you for Nclex guidance? Of
course. You can always send me an email to YouTube at manasseh.com. That's YouTube at manasseh.com. And I'll try and answer your questions. I know I get thousands of emails, but I'll try and answer your questions, because I think that's the best way to get in touch with me. So please try that, and then I think that we can catch up from there. I'm also on Instagram with the same name, Manasseh BSNRN. So
Thank you so much, Manasseh. I'm very happy that you made time for us to have this discussion. I'll definitely come back to you for another more interesting topics for us to discuss. For now, I say thank you.
Okay, thank you. You're welcome to.
Bye-bye.
Bye.